This is The Raid, exposing the dark world of America's deportation machine. I'm your host, John Carlos Frey. Welcome to the podcast. Imagine you're sick. Not a cold, not something a few days in bed fixes. You're really sick. The kind of sick where people around you start making phone calls. Now, imagine you're sick and you're in a detention facility run by the United States government. You crossed a border, or you overstayed a visa, or you showed up at a port of entry and asked for asylum. Or maybe you're in the country with legal status, but you're wrongfully detained. And now you're sick. And you're locked up, and the people responsible for your care have made a calculation. That calculation, it's cheaper and cleaner to let you go while you're still really sick. Not necessarily send you to a hospital, not to a family member who can care for you, just kick you out. Dropped at the curb, handed a bus ticket maybe, or nothing at all. And when you die, and some of them do die, it doesn't count. It never counted. And now they've made sure it never counts again. For our weekly news update, I try to focus on events within our government many of us know little about. Although the story is being reported on some level by national media, the details are thin. I want to walk you through one of the most deliberate acts of institutional erasure that I have witnessed in my years covering immigration enforcement. It doesn't involve a single dramatic moment. There's no smoking gun document, no whistleblower. It's something quieter than that. It's a policy memo. But what that memo does, and what it was designed to do, is make people disappear from the record. People who were already erased once. As a foundation to this podcast, it's important to know about how death works inside immigration detention. ICE, the Immigration and Customs Enforcement Agency, is required to report in-custody deaths. That's the rule. Someone dies while they're detained, it gets logged, it gets investigated, it goes on the books. The reports of in-custody deaths are made public and sent to Congress. For years, advocates, attorneys, and journalists, including this program, documented what happened to the rule in practice. ICE was releasing detainees who were near death, not transferring them to better care, not discharging them through a medical process with oversight, releasing them. Think about what that means operationally. A person is sick, maybe dying, they're in a detention facility, medical staff or detention officers or someone in that chain of command makes a decision to process them out, get them off the rolls, because a person who dies outside the facility doesn't count as an in-custody death. The numbers stay clean, the liability disappears, there's no need to report a death to Congress or to the public, and the family, if there is a family, and if anyone is even looking, is left holding nothing. No report, no investigation, no record at all. I want you to understand the cold precision of that. This wasn't an accident. This wasn't negligence in the traditional sense. This wasn't incompetence. This was a system. Release the ones who are going to die. Release them before they die. Make sure the clock stops before they're on your paperwork. And it worked. For a long time it worked. Until it didn't. Advocates documented the pattern. Attorneys filed suits, investigators produced reports, families testified before Congress, and eventually, not quickly, not without years of fighting, the government put in a rule, the 30-day reporting window. If a detainee was released from ICE custody and died within those 30 days, that death still had to be reported, still had to be counted as connected to their detention. 30 days to investigate. Because it takes time to die from what happens to you inside a place like that. Sometimes a person makes it out the door before the damage done to them inside finishes what it started. 30 days said, we see that. We're counting that. It wasn't justice, it was a floor, the bare minimum of accountability. But it was real. It had teeth. It had teeth. That 30-day window for investigation, for accountability, has just been removed. ICE has issued a new internal policy, Effective now, a death only counts as an in-custody death if it happens inside a facility. That's the entire rule. You can be taken from a hospital bed, you can be pulled from an emergency room, processed out through detention, and left on a sidewalk outside. When you die, that night, that week, 29 days later, it doesn't count. It doesn't get reported. It doesn't get investigated. It never happened. It doesn't exist. They found the loophole. They got caught using it. They were forced to close it, and now they've blown it wide open again, and now they're calling it policy. Why even bother to change a policy that was in effect to solve the problem of accountability? There's only one answer. Detention beds are on the rise. Billions more are being spent to house thousands of more immigrants in the coming months. Deaths are sure to rise. Changing the policy changes the death count. It's twisted, deplorable, and inhumane. I've covered this beat for a long time. I've sat in small apartments and listened to people describe that last time they saw a family member, healthy when they crossed, sick when they were detained, gone before anybody could get to them. I've read autopsy reports. I've read medical logs from detention facilities where a person went from presenting with symptoms to dead in a matter of days because the care either didn't come or didn't come fast enough or came from someone who wasn't equipped to give it. And the thing that stays with me, the thing that I come back to, is the paperwork. Because the paperwork for the federal government is everything. If a death is reported, it can be investigated. And if it's investigated, it can be found to have been preventable. If it's found to be preventable, someone is responsible. And lastly, if someone is responsible, something has the possibility of changing. That chain, report, investigate, find, hold accountable, change, that chain is the only mechanism we have. ICE just cut the first link. No report. The first of the chain doesn't matter if there's no report. Let's just call this what it is, a cover-up. And a cover-up isn't always a dramatic thing. It doesn't always look like shredded documents and secret meetings and prosecution. Sometimes it looks like a memo. Sometimes it looks like a quiet update to a reporting protocol that no one's paying attention to. A cover-up is when you have information that creates accountability and you take deliberate steps to ensure that information never reaches the record. ICE knows what happened under the old policy. They know the bodies that were released and dropped and left to die off the books. They know because they were the ones doing it. They know what the 30-day rule was designed to prevent, and they eliminated it with full knowledge, with full intent. That is a cover-up. And it's happening right now in plain sight because they're betting you won't notice. This is not a story about the past. This policy is active. It's in effect right now. There are people in ICE detention tonight, somewhere in this country, in a facility you will never see, in a town you may never hear of, who are sick. Some of them will be released before they die. And under this new policy, when they die, it will not be counted. Their deaths will become invisible, the ones who don't show up in the statistics, the ones who can't be investigated because there's no investigation, because the trigger that sparks an investigation has been removed on purpose. ICE can change its policies. It can't change what happened. It can't erase the testimonies, the lawsuits, the medical records, the families who are still fighting, and it cannot stop us from counting. That's what the RAID podcast is going to do. That's what advocates and attorneys and organizers who have been fighting this battle for decades do. We're going to count. We will document. We refuse to let the record be erased, even when people in power are trying very deliberately to erase it. If this story has reached you, share it. Send it to someone who doesn't know this is happening, because someone has to keep counting. Thank you for listening to The Raid, available wherever you get your podcasts. For more information about our guests and the subjects we cover, please visit our website at theraidpodcast.org.